person know if the oophorectomy is appropriate or a hysterectomy?
Again, it would be something that you'd want to talk to your doctor about. For something like Lynch syndrome, where endometrial cancer is also a risk, those women typically get both the ovaries and uterus and fallopian tubes, everything. For if it's BRCA and there is not necessarily a risk for uterine cancer, having your uterus out may affect what kind of hormone replacement therapy you go on. So it's very individualized, but having the uterus out is a more intense surgery with a slightly longer recovery time depending on how they do it. So it's important just to get what are the risks of the surgery, what are your personal risk factors for uterine cancer, or if you've had uterine problems that would make sense to remove the uterus as well.
Sure. Sharat, is there an age at which I should, if I have a BRCA mutation, I should tell my daughter? Is there an age at which it's appropriate for her to start thinking about interventions, or that it's kind of appropriate for her to know about this?
So I spoke to our genetic counselor about that, and her response was that generally it's okay to start talking to your daughter when she's in her 20s. And again, you would have to decide that based on your knowledge of, who your daughter is. So that was one recommendation. And the second recommendation was that, if there is ovarian cancer or breast cancer in the family, you may want to have that conversation 10 years from the age of the woman who was diagnosed with cancer. So you want to go back 10 years.
And is that the point at which if there's a family history or BRCA mutation, they might start doing a transvaginal ultrasound or mammograms or something?